So I'm delighted to be joined today by Dr. Kevin Cheng, the founder and CEO of Osana. And he's going to tell us a little bit about the Osana journey and his plans for Osana over the coming years. Can you start by telling us a little bit about your background in healthcare and your journey so far?
Sure, Jay. So I'm an Australian trained GP. I've got an interest in helping patients with long-term health conditions, and more recent years has been helping government and private healthcare companies build new models of healthcare.
Okay, and so what do you see are the biggest challenges in delivering high quality and financially sustainable healthcare in Australia over the coming decades?
Sure. So the first thing that comes to mind is we're going to run out of money. Treasury tells us that by 2046, we'll sink all of our state revenues into healthcare. So no more money for schools and highways and whatnot. I think predominantly our payment model is focused on paying for activity most of the time and not really rewarding quality outcomes. And also providing a way that we can invest more into prevention. Up to about a quarter of healthcare costs can be avoidable if we invest in primary and secondary tertiary prevention.
Okay, so what is Osana and how will it address the challenges that you've just outlined?
Sure. So Osana is a primary care value-based service, primarily focusing on delivering quality outcomes. We're going to share in the responsibility of patient outcomes and health system outcomes. We're a service that focuses on being proactive about population health, not just reacting to when patients get sick. And we really want to reward clinicians to invest in good prevention and good quality care, what we call slow medicine.
What will the experience be like for patients who are going through your clinics?
Yeah, so the experience for patients will feel different. They'll not only get a GP, but a team that will really focus on their prevention and make sure they're getting the best services and access to deliver the best outcome for them. They'll be able to experience a range of activities in the clinic, like education classes, community events, to really activate their understanding of health and to network with others. And healthcare will be easy for them, so they'll be able to call their health assistant or their GP. They can have consults for simple things over the phone or via video, and we'll go to them rather than necessarily patients come to us.
How do you think it's going to feel different for GPs working in an Osana care clinic?
Sure. So we want the experience to be quite different for GPs, actually. We want them to slow down and practice slow medicine, spend more time with less patients. We're paying GPs a salary to really separate from the pressures of fee-for-service. The second is we're providing a clinical and a non-clinical helper for each GP. So in fact, they're direct reports to the GP. So the GP runs a team that looks after a population proactively as much as possible. And the role will be quite varied as well. At times they'll be seeing patients, sometimes doing home visits, doing telehealth. They'll be running patient classes. They'll be having case conferences with specialists and running team meetings. So we think the variety is going to be an important part of changing that experience for the GPs.
And how do you define outcomes-based healthcare, and why is it so important?
I'm a firm believer in the quadruple aims of healthcare improvement. So we want to keep patients healthy, happy, make sure our staff are satisfied in working in a new model of care, and to make sure it's sustainable and cost-effective for the health system at large. More than anything, I think it's important we're all accountable for how taxpayers' money are being used in the healthcare dollar.
So how will the Osana care model help us move towards outcomes-based healthcare?
Sure, so we're really going to focus on outcomes, measuring outcomes and make sure that's part of our DNA. We're going to be engaging with patients, importantly, to be partners in their healthcare, so really focusing on patient activation, education, and making it easy and convenient. So having a bus and providing teleconsults and going to see people in their homes. And we're also providing GPs with a team. So every GP has a clinical helper and a non-clinical helper to really focus on prevention.
So from your personal perspective, what was the tipping point in making you realise that we just have to fundamentally move away from our fee-for-service model towards incentivising outcomes-based healthcare?
Well, when I look at healthcare compared to other industries I've worked in, it seems to be completely opaque in terms of performance and transparency on outcomes. So that's one big thing that I realise comparing to other sales and service organisations and industries. The second is when I talk to patients, it's actually quite challenging to navigate our health system, particularly with chronic health conditions. They don't always fit into 10 and 15-minute appointments. And third is, I think there's a huge opportunity to employ and deploy more technology and up-to-date systems to make healthcare delivery a lot more relevant.
Great. So could you tell us a little bit about the 3 phases of the Osana Care rollout?
Sure. So in phase 1, what Osana is trying to do is to build and test a new model of care in a handful of clinics in Sydney. The second is we're going to be measuring outcomes week by week and from day one. We're going to be working with university partners and would be taking those outcomes to government, to health insurers, and also publishing our results. And then the third phase is to move this model interstate and hopefully have other GPs pick this up and be able to provide it to their patients.
Assuming phase 1 is successful in creating that evidence base that shows that slow medicine really does work, how are you going to scale the Osana Care model nationally?
Sure. So the first will be to invest upfront in evaluation, making sure that we're collecting data properly from day one, sharing data back to our clinicians and also with our university partners along the way. And then once we get runs on the board is to take that to government and health insurers. Second is we want to mobilise the medical community. So we now have over 200 GPs that want to work under this model across the country. And it's really making sure they're excited to kind of lead the teams that helps patients in the right way. And over time, we want to have enough attention and pull from clinicians who want to be working in this model. And the third is to change public opinion around what healthcare should feel like, principally by providing a different experience to healthcare.
Thank you so much for taking the time to share your experiences with us today. We really wish you the very best of luck in rolling out Osana Care, and we'll be watching your progress with great interest.
Thanks, Jay. Cheers.